going to talk you through how to do CPR to a baby. So a baby who is not breathing and the heart has stopped. So you do your usual assessment. I'm going to demonstrate how to use 2 thumbs and 2 fingers. So people do whatever they prefer or whatever they feel comfortable with. So when you do the rescue breaths, the 5 rescue breaths, don't do the full head tilt chin lift because you could cause a lot of damage to the baby. So you want to keep them as flat as possible. Sometimes actually if you can put something here to just support the baby. So I'm going to support the head like this and support the chin with 1 finger. So I want to cover the mouth and the nose so that I can blow into the lungs. So you don't want to give them a full breath as you do with an adult, because otherwise their lungs are so small, they're not going to be able to contain that much air. So they have to be shallow breaths. So 5 breaths like this. So 5, then after that, I'm going to use 2 fingers to do chest compressions. So I'm going to support the baby's head, then do my chest compressions right in the middle of the chest. So I want to do 30 compressions. And once I've done my 30 compressions, I can then come back and do the rescue breaths. So I'm doing 2 to 3 centimeters deep, or a third of the child's chest, because obviously I can't use the one hand as I would do with an older child, or even both hands. I'm going to crush their chest. So 2 fingers just help you to get the 2 to 3 centimeter depth that you need. So the speed is 100 to 120 compressions per minute, 30 compressions to 2 rescue breaths. If I'm using thumbs, it's the same thing. You're going to give them 5 rescue breaths. Then you're going to go in the middle of the chest like that. So it's almost like you're massaging the chest with your thumbs. So it's like this. So again, the same speed, 100 to 120 compressions per minute, 2 to 3 centimeters deep, or a third of the baby's chest going down. So really simple, straightforward. So in summary, you can use either 2 thumbs or 2 fingers to do your chest compressions for a baby. Make sure you give them the 5 rescue breaths first. Don't do the full head tilt chin lift as you do with an adult. You're going to actually cause a lot of damage. So just a really gentle lift, and then you blow 5 shallow breaths into their mouth, and then you do chest compressions with 2 thumbs or 2 fingers depending on your preference. Then after 30 compressions, 2 rescue breaths as you would do with a child or an adult. Make sure obviously that the ambulance is on the way before you start. But with children and babies, what is recommended is that you do 1 minute CPR if you are by yourself before you call the ambulance. The reason being, in most cases, it's hypoxia that is the problem, the lack of oxygen. So if you give them the oxygen, many children and babies recover very quickly, and even by the time the ambulance comes in, even if you needed to then do chest compressions, you have given them that best chance to survive and return of consciousness. So there you go. That's how we do CPR for a baby.